Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Becoming a new parent can be a momentous experience for anyone and a goal that many of us have. You identify as LGBTQ and you want to experience the joy of raising a family. And it is great now that options are available. Here to talk about ways to become a parent is Dr. DeAnna Young. She's an obstetrician and gynecologist with the Scripps Coastal Medical Center in Encinitas, California. Dr. Young, thanks so much for being with us.
Thank you for having me.
So let's first talk about two women. What are their options if they want to have a baby?
So the good news is there are lots of options for them. This could include artificial insemination with donor sperm, could include in vitro fertilization. It could also include adoption or fostering.
So go back and explain a little bit more detail. What is donor insemination?
So with donor insemination, a sperm donor is identified either through a sperm bank or through someone that they know. And then that sperm is inserted into the uterus and is allowed to meet up with that person's egg that she has released. And then she will get pregnant.
And then talk a little bit more about in vitro fertilization. What is that?
So with in vitro fertilization, an egg and a sperm are joined together outside of the body. It could be an egg that's collected from the mother who's intending to carry the baby, or it could be an egg from the partner, or it could be a donor egg.
Or each woman could donate an egg and then they could have twins, right?
That would be really fun, yeah.
And then there's also surrogacy. Talk a little bit more about that.
So if for some reason the intended parents cannot carry the baby themselves, they may use a gestational carrier or a surrogate, and the pregnancy is then implanted in her uterus and she would carry the pregnancy for them.
And then what about two men? What are their options?
So their options are going to be very similar. They have the option of using a surrogate, or sometimes you may hear the term gestational carrier, and use a donor egg, and they can use their own sperm, or if for some reason they couldn't provide sperm, they could use donor sperm. Or again, as for lesbian couples, the options could also include adoption and fostering.
And if both of the men wanted to become dads, they could each donate sperm, but you can't donate, you can't combine the sperm for one egg, right? They would each have to donate sperm and then for two eggs, and then they'd have twins.
That's correct. Only one sperm can fertilize one egg. So if they both wanted to be fathers, then they would be looking at a situation with twins.
So for the gay men, they're going to have a woman, carry the baby through pregnancy. Is it a good idea to do this with a stranger or a woman, for example, a friend or a relative?
So there can be benefits and drawbacks to doing it either way, and it can be a little bit complicated to make that decision. I will say the one benefit of using a stranger and going through an agency is that you do get some assistance around some of the legal issues related to surrogacy.
And so what are those legal issues?
So there can be issues around parental rights, who is actually deemed the parent of the child, which can have impact on things like custody and child support, etc.
And those are all legal documents that she would fill out before the pregnancy?
That's correct. And those are typically handled through the agency and their lawyers.
So how do you decide whose sperm you're going to donate?
Well, I think, again, that's a decision the couple has to make together. Certainly, you would want to evaluate each partner for health issues, because that may point you in one direction or the other. And then together, you can decide which is the best pathway for you.
And then what about adoption?
Yeah, adoption's another really great option. And there are agencies around the county that would be able to help couples figure out if that's the right choice for them.
And all of these options are not inexpensive, are they?
They are not. Depending on which option you go with, you could be looking at anywhere from tens of thousands up to $200,000.
Wow. Is this covered by insurance?
Again, depending on the situation and your particular insurance, pieces of it may be covered.
So this is something that you should really talk to your insurance company about before you embark upon this journey.
That's correct.
Are there any red flags? What should you be looking out for? For example, what medical tests should you undergo before you start to embark upon this journey?
Yeah, that's a great question. And I really think anyone planning to embark on building their family, whatever way they approach it, should make sure that they're regularly seeing their doctor and getting their regular screening tests. If you are interested in something like in vitro fertilization, artificial insemination, etc., then I would definitely recommend seeing your OBGYN or your primary care doctor to get the appropriate tests before you start that process.
What kind of tests are we talking about?
It could be blood tests, it could be ultrasounds. Again, it would just depend on exactly what method you're planning to pursue.
Any final thoughts, doctor?
Yeah, I think the best thing to know is that there's lots of options for growing your family, and that we're here to support you in whatever way that we can as you navigate this journey.
Doctor, thanks so much for joining us. We appreciate you taking the time.
Oh, thank you so much for having me.
If you'd like more information on having a baby, if you identify as LGBTQ, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.